We know that ionizing radiation is not without risk. We know that the amount of radiation that an individual receives is cumulative, and we know that the increased risk of cancer from the use of ionizing radiation can actually be calculated. Now, we also know that we can improve the way that we use radiation. In this particular study of a 2006 Children's Hospital survey, they looked at the average radiation dose that patients who had had exams done elsewhere and were sent to them for referral. So a patient would have an exam, say in a hospital in some small city. They would send that patient or the x-rays to this pediatric hospital for evaluation. They would send the CTs there, and they looked at these CTs and they looked at the rate of the radiation use. And what they found was that adult CT techniques were used in 68% of the body CTs in these children and 41% of the head CTs, meaning that these children were getting more radiation than they should have. And this study was actually published in 2001. Now, a follow-up study to that was published in 2008 actually showed that there was a significant improvement, that there was a decrease in the amount of radiation that was used for chest CTs and abdominal CTs, as you can see here. That was very significant, meaning that the education that is ongoing about this is allowing us to use lower dose radiation, especially in children. And there are some large campaigns that we'll discuss in a few minutes that are supporting that effort. But the point is, we're getting better. However, this study also pointed out that we're not there yet. That despite the high percentage of radiologists using age or weight-based protocols, meaning a way to reduce the radiation dose, they found that 22% did not know which protocol they used or skipped that question. And an even higher percentage, 49%, did not know or complete questions regarding the techniques that were used in their patients. So we still have a ways to go, but the encouraging news is that we're making progress and more people are aware of this, and we're decreasing the radiation dose, which means we're decreasing the cancer risk. Now, this may look like something out of Star Wars or a little strange, but this is actually some material that we are testing currently in our facility to reduce radiation dose during CT scanning. And we actually do put people under this type of protection when we're scanning them, so that we scan the body part of interest and the rest of the body is shielded from any excessive radiation. This is an example of an individual who is having a CT scan of the foot, and you can see that we have this individual completely shielded. You can also see that we have radiation monitors on this individual, and there was 0 radiation dose to this individual's brain, eyes, thyroid, and ovaries, the critical organs, when this CT scan was performed. So we can protect individuals from the scatter radiation that's occurring, and we can decrease the radiation dose in some instances to the critical organs, those that are most likely to get cancer, as low as 0. This is a study that was conducted at the National Institutes of Health, looking at using the CT shielding during CT fluoroscopy to not only protect the patient, but also to protect the doctor. In this particular instance, they found a 92% reduction to the patient lens in adults, an 85% reduction in pediatrics, and an 85% reduction to the radiologist when this shielding was performed. Using increased amounts of shielding, they were able to reduce the radiation dose as much as 99% to critical organs in the physicians performing these procedures. This is an example of a cardiac CT scan. This actually is my own cardiac CT scan in which I was shielded, and that shielding resulted in a 60% decrease in my gonadal dose, 75% in thyroid dose, and 95% decrease in my brain radiation dose by using the shielding that we just looked at. So in addition to using improved CT techniques, we can also use CT shielding to improve reduction in radiation dose to our patients. The most important patients, as I've indicated before, to provide this shielding for are children. This is just showing you CT protection in a child. You can see the blue apron around the gonadal region and the lower extremities, and the little cap that this infant is wearing is also a radiation shielded cap to protect the brain. One of the things that's been used for a long time in taking care of particularly very young children, premature and neonates, premature infants and neonates, is something that's referred to as a babygram. The reason for that is it's difficult to shield. on these individuals, or difficult to keep the amount of radiation low because they're so small. It's hard to be sure that you get the X-ray collimated well, and when you do collimate it, if you over-collimate, you have to repeat the exam, and you want to keep the exams to a minimum. So tend to do examinations that are referred to as babygrammes, and this is where you see basically an X-ray of the entire infant. Now you may think that that's not very common, but in fact this is a study from not that long ago in a pediatric hospital, 2-day-old infant. These are X-rays on a monitor, on a rotating device that allows you to look at all of the different X-rays, and you can see as they go by the number of babygrammes and X-rays that this young infant had. And as you watch this go by, you begin to, if you think about it a little bit, think about the statistics that I showed you, think about the graph that I showed you. The younger you are, particularly if you're female, the greater the risk of cancer. Think about the possibility that this might be an infant who, if it's a female infant, is positive, genetically positive for breast cancer. What you start to look at are some pretty frightening statistics. You can see that there's an upper GI procedure that's performed here. There are CT scans of the brain that are performed in this instance. So a significant amount of radiation in this very, very young infant that you would want to, as much as possible, keep that dose as low as you can. And the number of imaging procedures performed before the age of 2 months in this child is 62 plain films, 2 CT scans, and an upper GI. And that seems like a lot of examinations. You may say, well, that's not very likely. I mean, are places really still doing that? Is this still happening? Well, this is a New York Times article published on February 27th of 2011, so this year. And you can see that the topic is X-rays and unshielded infants. You can see that this is a babygram, just as I showed you in this last segment. And this is from that article, demonstrating the X-rays and unshielded infants that was found, with a statement by the chief of radiology that was mortified, full, unabashed, total irradiation of a neonate, this poor defenseless baby. That was the comment by the individual who discovered this as the head of this department and put in safeguards to try and reduce this radiation dose. This is excerpts from that article where he states, a day earlier, Dr. Scalafini noticed that a newborn had been irradiated from head to toe with no gonadal shielding, even though only a simple chest X-ray had been ordered. And the problems did not end there. Dr. John Amodio, the hospital's new pediatric radiologist, found that full-body X-rays of premature babies had occurred often. The radiation levels on powerful CT scanners had been set too high, the other thing that we've been talking about today, and that babies had been poorly positioned, making it harder for doctors to interpret the images. So the whole point here is that even though we hope to improve these things and make them better, we have to look everywhere to make sure that children in particular are being very safely cared for. They also pointed out that the errors at downstate raise broader questions about the competence, training, and oversight of technologists who operate radiologic equipment that is becoming increasingly complex and powerful. If technologists could not properly take a simple chest X-ray, how can they be expected to safely operate CT scanners or linear accelerators? And then another comment is, I would think the public would be outraged that Congress was sitting on what could reduce their radiation exposure. And this is a quote from Dr. Fred Mettler, who is one of the preeminent radiologists in the world on radiation safety, and has written extensively about radiation accidents. And then this is another comment. It's amazing to us, knowing the complexity of medical imaging, that there are states that require massage therapists and hairdressers to be licensed, but they have no standards in place for exposing patients to ionizing radiation. This is a quote from Christine Lung, the Technologists Association's Vice President of Government Relations. So the point here is that we can't necessarily assume that we're doing things correctly. More and more we need to be careful about this, but we also need to try and be careful that the individuals who are performing these procedures are well trained, and that when X-rays are being performed, that we're keeping the doses as low as reasonably achievable. Continuing that conversation, with technologists in many states slightly regulated or not at all, their own professional group is calling for greater oversight and standards. For 12 years, the American Society of Radiologic Technologists has lobbied Congress to pass a bill that would establish minimum educational and certification requirements, not only for technologists, but also for medical physicists and people in 10 other occupations in medical imaging and radiation therapy. This is an example of what can go wrong. This is a 23-month-old male who sustained a neck injury on January 23, 2008, was taken to an emergency room in a community of about 17,000 people. This is not a really small town, it's a pretty good sized town. And he was unable to lie still during the CT neck examination. The initial CT evaluation included 151 CT scans. Now this is not individual images. This is total numbers of scans through that entire area over a 68-minute time period from a single technologist. Then a radiologist who looked at this examination felt that there was too much motion and had a second radiology technologist perform additional scans. That was 15 more scans. The child returned the next day to the hospital with radiation burns under the eyes and the lower half of the face and serious chromosomal damage from the radiation exposure. Here you can see the child, and you can see what looks like a sunburn across the space underneath the eyes. That's actually a radiation burn. And this is an example of how this advanced technology can unfortunately cause injury to a patient.